Good afternoon, everyone. Alisa, Haushalter, Director of the Shelby County Health Department, and on behalf of Mayor Strickland and Mayor Harris, I want to welcome you to the Joint Task Force update. Today I'm going to give some data updates, but I also want to talk about some of the activities that are occurring relative to our overall response, and then I'll turn it over to Dr. Randolph, who will talk and give more updates about our enforcement activities, and then we'll open it up to questions. So as of this morning, we have 53,058 cases. That's an increase of 695 in a 24-hour period. We've experienced 722 deaths, and the average number of reported deaths is increasing in more recent weeks. So we are averaging about 5 to 6 new reported deaths per day. Currently, we have 3,595 active cases in the community. Those are individuals who have been diagnosed with COVID that still are infectious and pose a risk to others. Our positivity rate is at 12.9% over the past week. That's well above that 10% average that we would prefer to be below, and so it's an important number to look at, and our reproductive rate is over 1 at the current time. Also, we have over 8,000 individuals who are in quarantine at the current time because they've been exposed to somebody who was actively infectious. I'm going to give a few updates on the gating criteria and then that overview of the response per se. We continue to have a significant amount of testing capacity. In addition to our already existing capacity, the city of Memphis is hosting regular testing each weekend through the holiday. So we're really encouraging people to know their status. Please go get tested and know your status. And this is specifically important for individuals who are less than 40. Everyone's welcome to be tested, but we need more information on the population that's younger than 40 because they're more impacted currently by the infection. Our hospitals continue to have strain on their capacity. They're doing everything that they can to be able to meet the needs of the patients that they serve. But we do anticipate this continuing to be a challenge because of the current surge, which is significantly worse than the surge we experienced earlier in the pandemic. Within public health, we're doing everything that we can to continue to do contact tracing. That's not just the health department alone. Many employers, school systems, and others are assisting with one, notification of people who are positive, but also placing them in isolation and assisting to identify their contacts. Continue to do a great deal of enforcement, which Dr. Randolph will detail, and we're also prepping for the vaccine. So some of the key things that I wanted to note, we have said for some time now that we are really at the fall surge, that we were foreshadowing a very difficult fall and early winter. But in addition to this being the peak of the pandemic, not just in Shelby County but nationwide, this is actually the peak of our response locally. So I think it's important for all of our citizens to know what's happening, one through the Joint Task Force, but also many other partners who assist as ad hoc members along the way. In regards to hospital capacity, there's been significant effort put forward to look at what can be done collectively to assure adequate staffing in the hospitals. There's been work with the healthcare systems as well as with the local academic institutions to look at how we can utilize students or individuals who are near the end of their education to provide additional support, not just for hospitals, but for the bedside, but also for vaccine administration and vaccine administration to the community. So that's moving forward. There will be a tabletop exercise in the upcoming week that helps identify what those stressors on the healthcare system will be and what the possible solutions are so that we can move forward with those. For vaccines specifically, there's actually a lot of unknowns still, but quite a bit of effort underway for planning. Ultimately, over the course of a year, the goal is to attempt to vaccinate about 70% or greater of our overall population, starting with those who are most at risk because they're frontline. But in some communities, not Shelby County, there's only maybe 1 or 2 agencies who are able to deliver vaccine. Because of the size of our community and all of the partners, many people will be at the table to deliver vaccine. Healthcare systems will deliver to their own employees. The health department will administer to first responders in partnership with the municipalities. So we will do that again as partners. And then over time, pharmacies and others will also receive vaccine. So this is quite a feat. It takes a lot of coordination and logistics, and there is a lot of work happening on behalf of Shelby County. So I applaud all of our partners and just want to reinforce to the community that all that we can do is being done. The last thing I want to mention is communications. There's a lot of need for information about the vaccine. Until there's FDA approval, that communication can't be 100% finalized because we need to know what the FDA recommendations are and the identified side effects. So we ask you to be patient and stay tuned for information and really look to either the Shelby.community website or the City of Memphis website so that you get information that's accurate and timely. There's a lot in the media right now, but all of that is preliminary information or in some cases conjecture. So we encourage you to be patient and know that we'll get the information out to our community as quickly as we can. Lastly, everyone's well aware of what you can do to reduce transmission in our community, so I ask you to continue to mask up, continue to limit your contact with people outside of your own household, keep your gatherings small. As we go into the holidays, limit your travel, and as always, wash your hands. So I'm going to turn it over to Dr. Randolph to talk specifically about enforcement, and then we'll open to questions.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. I'm Dr. Randolph, Health Officer for Shelby County Health Department. Just want to spend a little time talking about the enforcement, particularly this coming weekend. As you well may be aware, we have increased our efforts in enforcement, and we have asked the law enforcement officers, police and sheriff, to accompany our team as they go about to investigate complaints and inspect services and establishments. So we have teams of 2 inspectors who will go out along with law enforcement officers, and we will be following up on the complaints that we've received. We so far have received over 70 complaints that we will prioritize and investigate. It is important that we have the law enforcement accompany us because we have received threats. Our staff has received threats and even racial slurs, both of which are not tolerated and will not be tolerated. It's very important that we're not out to just close businesses. We're out to protect the public's health. And our staff is simply doing their job when they come to visit your establishment, and we'll be looking to see whether or not there are violations. The specific type of violations that they're looking for actually are things such as whether or not your employees or your customers are wearing masks, whether they are socially distanced 6 feet or more apart, whether there's crowding, standing, and gathering, whether the bar is open, smoking, dancing. These types of things are outlined in the health directive. So I encourage you, if you don't already have a copy or don't know what the health measures are, that you obtain a copy of the health directive. It's on shelbytnhealth.com, and you can obtain the copy of the health directive to make sure that you're in compliance. We also provide technical assistance if you have some questions. We feel that we have provided a lot of technical assistance. We have preached and begged and pleaded. And now I think that when we take action, it will be appropriate. Action can vary from a warning to closure immediately or the next day, depending on the situation. Just to give you an idea of what our investigation inspection team do, they have a checklist. They enter into a facility and they look to see if indeed you're in compliance with the things on the checklist. After they have finished their inspection, they should provide you with a copy of that checklist that spells out the violations that they found. And so you would know exactly what it is that you are in violation of. Now, I just want to let folk know that we trust the integrity of our inspectors. And so when they report to us, and we review those reports to make a decision of whether or not actions of closure should be taken, we trust and rely on the accuracy of their reports. So there's not much of an appeal process. So we have warned you, we have educated you, and when the inspectors find you in violation, there's really no need to call me, Mr. Sweat, Dr. Haushalter, to try to see if the actions can be reversed, because we trust the integrity of them. Again, I want to just say it is not our intent to close facilities, businesses. We want to work with you. We want to stay as open as long as we can, though our numbers are increasing. One last thing I want to just say a word about tents. I received some questions about it. Our position as it relates to tents is this. If the tent is closed, all the flaps are closed, where now you got an enclosed facility, that is considered an indoor facility. And all of the health directives that applies to indoor facilities, such as not smoking, etc., will apply. If your tent have all of the flaps up, where normal flow of air occurs, then we consider that outdoors. So be clear, just because you have a tent doesn't mean that it's automatically outdoors. It's only if the flaps are up and adequate ventilation is occurring. Keep in mind, when you have a tent and it is enclosed, all the flaps are down, you really have an environment that's worse than indoors, because you don't have a HVAC system, you don't have the ventilation. And so smoking, vaping, and hookah and all those types of activities would be forbidden in indoor settings. Lastly, we just, again, want everyone to do their part so that we can continue to remain open and functioning and having some resemblance of normalcy. With that, I will stop and entertain specific questions you may have.
Dominique Dillon, Fox 13.
My question is regarding vaccines. In particular, if a person has already got COVID, will a vaccine benefit them? And if so, where do they fall in the priority of getting vaccinated?
Currently, our recommendations relates to vaccines is that if someone have had COVID, we still would encourage them to get the vaccine. And depending on what their situation is in terms of where they fall in the priority, you know, if it happens to have been a healthcare worker who's working around COVID positive people and at high risk, we would encourage them to get the vaccine primarily because we still don't know how long that immunity lasts from infection.
And also, have you guys started to see numbers from Thanksgiving?
We believe that the numbers that we are seeing now is the result of the Thanksgiving activities. Today is 695. Today also mark 14 days from Thanksgiving, and so we know that the normal incubation period of the virus is 2 to 14 days. So folk who were exposed around Thanksgiving now may be experiencing the symptoms or signs of infection. So it wouldn't surprise us if our numbers increase, continue to increase.
Brad Broders, Local 24.
Yes, good afternoon, everyone. I know a couple weeks ago you all outlined the goal of potentially getting 33,000 initial doses. And I know there was the event last week with FedEx and the vice president, and I know the Moderna and Pfizer vaccine approval processes are still going on with the FDA. Has any of the numbers changed in terms of how much you all are expecting from both Moderna and Pfizer initially?
I'm going to ask Dr. Haushalter to speak to that.
That's a great question. I just want to reinforce that this is an unfolding activity. So the numbers actually change every day. They have gone up, but they also look at different allocation to different hospital systems, pharmacies, and so on. And there will be phased receipt of the vaccine. So we are likely to receive the Pfizer vaccine first, and that may be as early as a couple days to a week. And then after that, likely the Moderna vaccine. So we will continue to give updates as we have them, but at the current time, we're really not giving numbers, only because those are changing so rapidly, and we believe will continue to change. And your follow-up?
Thanks, Dr. Haushalter. As a follow-up, I know yesterday you may have seen the AP poll about some folks sort of hesitating about potentially getting the vaccine when it's available to the wider public. How does the health department plan on educating the public about the vaccine, separating fact from fiction on the safety, but also not seeming too heavy-handed in pushing it?
A very good question, and it's not just the health department. It's all of our partners on the task force, healthcare systems, and healthcare providers such as physicians and advanced practice nurses. The first thing that we're trying to do is really understand in our community what people's questions and concerns are relative to the vaccine. It's very easy to make assumptions based on history, such as the measles vaccine or other vaccines that people may choose not to have. But this is a very unique situation for different reasons. One, this is a new type of vaccine. It's come to the market faster than vaccines typically do. So we actually are going to do several things. There is a survey underway through the city of Memphis, and I encourage anyone who's asked to fill out the survey to do that. It'll be a telephone survey, so you may get a phone call asking about your concerns about vaccine. We did a previous polling survey in partnership with the University of Memphis, and then also through our partnership with the University of Memphis, we're going to hold some Zoom sessions or online sessions where community can give feedback about their concerns. We don't want to make assumptions and try to respond to the wrong question that people might have. And then the other is that piece of not being heavy-handed. As a healthcare provider, and particularly as a nurse, I really value people having information to make an informed decision. So our role collectively is to get information that's accurate and timely to the public so that people can make informed decisions for themselves and their families. Many of the partner agencies are doing training for their employees, like the healthcare systems. They obviously do routine training, but they're doing COVID-specific training so that people can make a decision around getting the vaccine or not. We will likely do that within the health department as well. It really is going to take all of us to try to make sure we're being transparent about the information that we have and getting it out in a timely manner. So we're also going to rely heavily on the media to help get out accurate information about the vaccine. In this case, vaccines, because there will be different types that ultimately come on the market.
Kendall Downing, WMC.
Good afternoon, everyone. First question is for Dr. Randolph regarding enforcement. I was interested if you could tell us some of the threats that the department has faced, just in a little more detail. Are these threats of violence? Are they threats of, just spoken word? Just without, disclosing too much information, can you detail some of that and tell us, will officers be accompanying every inspector this weekend? And then I have a follow-up.
Yeah, I won't go into it in a great detail about the threats, but there are threats of violence. And of course, we take them very seriously and will not tolerate them. The officers will accompany our inspectors on all of the inspections.
I just wanted to add to that a little bit because there have been threats towards the inspectors and those who do enforcement, but there's been broader threats relative to public health in general. And I know everyone's heard me talk about the nursing shortage. I just want to note that at this point in the pandemic, well over 90 healthcare leaders and particularly public health leaders have resigned their positions. And in many cases, that has been because of the threats towards them specifically. And we've all heard Dr. Fauci talk about the threats to him and his family as well. So it's a broader issue and that we're all wrestling with, and I appreciate you asking the question. Your follow-up?
Sure, and we certainly appreciate all the hard work that you all have been putting in. I know it's not been an easy time, and we appreciate all your work on behalf of all of us. My follow-up is with respect to hospitals. When are we still expecting, based on the modeling that we're seeing, when are we expecting that surge, the highest number in the hospitals? And can you talk about the work that's ongoing to make sure that other people that have things, and we talk about hospital capacity, but if someone has a heart attack, that they, have a bed available for them? Thank you.
So we are actually at a peak right now, but we do anticipate that to continue to grow, and really estimating mid-January to be extremely problematic. We also know around the Christmas holiday is going to be problematic because as Dr. Randolph noted, we're in the 14th day since Thanksgiving. So those who got infected are now beginning to become ill. But generally it takes another 5 or more days for a person to be ill enough to actually seek care. So next week we may see more numbers relative to Thanksgiving, and then the following week, as we get into the Christmas week, people may be hospitalized. So we anticipate that to be a challenge, and then obviously looking into January. And then what was the second part to your question?
Sorry about that. I was just interested because we'd seen some of this nationally, in some reporting, and we always talk about hospital capacity, but kind of the importance of, if someone has a heart attack around Christmas, there being an available bed for them, and, the hospitals being able to care for them without having COVID patients everywhere.
So great question. And we have said this before, but I think it's really important to point out the reason we really are concerned about hospital capacity is not just limited to COVID. If someone has a motor vehicle crash and has a trauma, they need to be able to get into the emergency room. So that's not just the hospital itself, it's the ambulance service. They need to be able to get in an ambulance, get to the emergency room, and get into the trauma area quickly. The same thing with the heart attack. So that if the hospitals are backed up or they're beyond capacity, the ambulances can't offload, so you reduce the number of ambulances in the field, and you reduce what they call that magical hour of getting a person from either an accident scene or from a heart attack into the emergency room. Then within the hospital, people need to be in the right kind of bed within the hospital. Maybe they need a medical surgical bed, maybe they need a trauma bed, maybe they need to be in ICU. And if those are all taken by individuals who have COVID, it's very difficult to meet the other needs of our community. We have stressed before, we continue to have opioid overdoses in our community. They're going up, and we all know we've had a record number of homicides this year. So it's important that we think about how all of these things are interconnected, particularly as we get towards the end of the year and towards the holiday season. Thank you.
Jacob Steimer, Memphis Business Journal.
Yeah, I wanted to ask first about the positivity rate being so high. Is the worry that the daily case count gets less? Is there a worry that daily case count is less accurate when the positivity rate is so high?
To some degree. So if it's two things. It's the overall positivity rate, but what we also know, because we've been able to bring to scale in Shelby County, are asymptomatic testing. We are seeing a large portion, so 10% or greater, and one recent was much higher than that one weekend, of people who have no symptoms whatsoever who are able to transmit. When you see that happening, that means there are many cases walking around that are not diagnosed. So that the daily number of cases is still a marker, but when you begin to have high positivity rate, you have to estimate that the number of true active cases in a community is much greater than you're seeing in black and white. So I said we had over 3,500 people who are actively infected. If we have a high positivity rate, it could be double or triple that in the community who are actively infectious. That then reinforces the need to do all of the mitigation efforts that we're talking about, because we know there's widespread transmission and transmission from individuals who are asymptomatic. And that is much different than the very early part of our pandemic. You have a follow-up?
Yeah, I was hoping that Dr. Randolph could speak a little bit more, increasing the enforcement efforts. It sounds like you're trying to get out this weekend to a lot of different places. And as far as these threats, is that specific to like restaurant bar type stuff mostly, or has it been wide? Thank you.
Well, yes, we will be out this weekend in increased numbers, inspecting even more facilities, responding to the complaints that we've received. And the threats have ranged, from when our inspectors visited certain establishments, but also over the social media, there's been some threats.
Jane Roberts, Daily Memphian.
Dr. Randolph, can you tell us how many businesses have been closed since last weekend, and is there a list of their names? And then I have a follow-up.
We closed last weekend total of 9 businesses. And we also post a list of businesses that we inspect and the number of violations that we find. You have a follow-up question?
My follow-up is, I wonder if someone could comment on morgue space now and what contingency plans are in place.
Thank you for the question. We actually had looked at morgue capacity in the very early part of the pandemic. The West Tennessee Regional Forensic Center provides those services on behalf of Shelby County. They do an excellent job every day, but we also knew that we might reach a point that we needed increased capacity, particularly for the hospitals if there was overflow. So there's a contract that was put in place using CARES Act money that allowed the Forensic Center to increase staffing to manage overflow, but also to have the additional trailers available so that if we needed to use that capacity, we could.
We are out of time today. Are there any closing messages?
I just want to say again, we're in the really peak of the pandemic and peak of the response, and we encourage everyone to do what they can to reduce transmission and assure that we have a safe and healthy community for all.
Thanks, everyone. Stay healthy, and we'll see you back here next week.